thank you, Sue. And for anyone who doesn't know, I did my undergrad at Oxford Brookes University with Ethel, so that explains the alignment in our interests and how I've ended up with a PhD. So very much thanks to Ethel. So I'm delighted to talk to you. What the last couple of slides that Ethel finished on, that's what we want people to take home with them. It's so important to keep re-emphasising that water birth is safe for mother and babies. That argument is finished now. So what we need to do is find ways to increase access and for women across the country. And like Ethel said, around this equity issue, we know women of Black and Asian and ethnic minorities are less likely to be offered and use the pool. So we need to know, and that was from an amazing paper that's in that quant review. So what I want to talk about is bringing this back to, we've got those quantitative outcomes, but to think about those women's experiences, which is the other review that we published a little while ago. Picking up on and reinforcing what Ethel's already said, the size of the pool matters. So I'm being a bit cheeky with this slide. Size matters in this circumstance. It absolutely has to be big enough to ensure full mobility. Yes, sitting in the bathtub in an early labour can bring some sort of comfort from the warmth, but if we're trying to maximise and get these optimal outcomes that we've reported in that quant review, then it needs to be big enough so women can move and birthing people can move around. It needs to be firm and stable. Women really enjoy, but a big part of the birthing pool experience has been able to hang off, lean over, etc. Obviously a clean water supply and hot running water. And this, I see so many videos online where women are literally sitting in basically a puddle of water. The water needs to come up over the bump and over the bum, right? Appreciate that some women do give birth quicker than the tub can be filled out, the birthing pool can be filled up. But if you're trying to go for it, make sure it's really full. So this is the review that we did a couple of years ago. It's a metathematic synthesis. For those of you who are trying to advocate for guidelines, updating your guidelines, etc., go find this paper. It's in the resources Sue has sent out, because what we've done is this quite easy to use, it's called Cirquel findings. So it's statements that, when you think about, you're trying to advocate to execs or managers who aren't in maternity and they don't really know about this kind of stuff. Those statements give them the information that they need with the confidence in those findings that they need to know to help support, improving your water birth service, rather than what I'm going to share with you now is much more of the interpretive, touchy-feely aspects of using the water. So do use that, go on and find it, because you can use that to advocate for your service. So there are only 7 studies, which was a real surprise actually, that took a qualitative approach, and you can see the countries here, not only 81 participants, but when we looked at literature to write our discussion and through our own knowledge, our findings are very much supported by numerous surveys. And you will know that for all of you out there who have facilitated water, had your own water birth experience or laboured in water, I think some of these findings will be resonant with you. So as I said, we did these different types of analyses, and what I'm going to talk to you about is very much these interpretive in findings. So it's taking that rich qualitative data and presenting it in a new way, and what all the papers said, which was mainly these 3 core themes. First of all, liberation and self-emancipation. There was this beautiful thing around synergy, transcendence and demarcation. And then finally, it was a transformative birth, but that also impacted the postnatal period as well, positively impacted the postnatal period. I can't, and I didn't plan to go into an in-depth presentation about all the different aspects. I've just pulled out the things I thought were particularly important for this evening. So in terms of liberation and self-emancipation, the women consistently reported that the birthing pool, their physical and psychological needs were met. For women who didn't pre-plan to use the pool, but the midwives were proactive in offering, those women have been captured in these studies, which is fantastic, because what they said, They hadn't thought about it before their labour, but when they got in at the suggestion and offer of their midwife, the benefits were immediately felt. It was obvious that this was really lovely. So that I think was really important that we captured that. Unsurprisingly, one of the big things is the buoyancy is so valued. Particularly think about ourselves at late pregnancy. We are feeling quite big and walking and moving. It's quite cumbersome. So of course the water gives that freedom of movement, easy position changes, and which helps enhance those feelings of control. And women are reported being active participants in their labour. Oh, and an interesting unexpected finding was this around those women who reported being self-conscious about their weight, but about their BMI. The water made them feel lighter, and they had that buoyancy, so they felt less self-conscious. And we know how important that is, that women don't feel self-conscious to really let go in labour. They also reported that they were worried before their birth or their labour that their partners couldn't support them because of their size. And then, as you can see, this is a great picture from stock images, you know, how well the partner can be involved in supporting the woman. And then if she was feeling conscious about her weight, then the water took that away. These are the main words women used, and I think this isn't so much of a surprise. Soothing, calming, relaxing, comforting. I really like this, the cushioned, and it softened the intensity. So it doesn't take the pain away. It's not an epidural, but it's cushioning, softening, enhancing control, instilling confidence. And for those who use water during a VBAC, it was a really powerful way to regain control over their birth experience. So I think what was really powerful, the data from the data, was this theme, synergy, transcendence and demarcation. And this is really about these psycho-spiritual effects and benefits of water. So, and that was really unpacked. The women went into a lot of detail. They were very articulate in these studies. The physical container itself was valued. So I've talked about the buoyancy, but the actual container created the safety, privacy. The women talked about this. They were naked but felt clothed because the water offered that for them. And this helped enable a letting go. And this idea, you know, a lot of us talk about entering labour land, and the water facilitated the physical container and the water. So you've got two different aspects that come together. And this is where time, for them, for those who entered labour land, time lost all meaning. And for some, not all, they transcended into an altered state of consciousness. So we said about the size, the solidity of the pool. So those in those ones like in a hospital setting, particularly valued because they are so firm. And for those who were in hospital, they really welcomed the pool. It mitigated against a harsh clinical environment, which is what the women said. So all of these physical attributes of the actual container, but then the actual physical separation of being in your own space, being in your container, was really welcome. And then add that this wonderful warm water, and the women reported it felt womb-like, cocoon, a safe haven, and it induced feelings of nurturance, being cherished, pampered, cared for. It also offered them security and protection, discretion, concealment, containment. And what was really interesting, there was a fabulous quote in a minute. It actually gave them their own territory where they could claim their own space. And it also gave them the empowerment and the freedom to choose to engage with their partner, the midwife, whoever was in the room, or not engage. They could go to the other side of the pool if they wanted, just to ignore everyone and just get on with their labour. So just take a moment to see these attributes and what these women reported, and just ask ourselves, what does this tell us about what women need in labour? All women need in labour. Yes, water is offering this amazing, it's a receptacle that can offer this, and obviously the care practice and people around you. But it doesn't have to just be in water. We give women the space and the environment to enjoy these types of things. So this is a couple of quotes. It was because the pool space was really safe. quite contained. It was dark, midnight dark, a place I could go to and feel safe, really safe. And thinking back, I'm sure that made the difference. What women need fundamentally for their psychological and physiological health is to feel safe, and the water seemed to provide that. I really like this though. I sank my ears under the water, so even if I'd wanted to hear the midwife telling me what to do, I couldn't. I was able to feel a sense I was in control of my labour. And then this last quote: water shrunk everything down so that time stood still. There was this kind of bizarre gap in time where she was fully born, where I felt like I was looking into her soul or something, like this incredible, unexplainable sort of period of time that I'd never felt before. And this is that transcendence. So the key message, yeah, there were only 7 qualitative studies, but certainly it was supported by the survey data. Side matters, can mitigate against these harsh clinical environments. So it's particularly beneficial in obstetric units, and that really much supports the finding of what Ethel's been saying, where we've got all of those studies based in obstetric units, and we know how hard it is to shift the dial in hospital settings in terms of experience and outcomes. Birthing pools could be a way, are a way, we've demonstrated that, so we need to increase the uptake. What was interesting in the qualitative data, these women talked much less about their midwife. So there seemed to be this opportunity for more self-efficacy, but I will put that with a caveat. It's not the midwife isn't important. We assume that she is competent and in favour of water to be facilitating that. So I think it really potentially captures that art of doing nothing, fading into the background, rather being centre stage within that woman's birth experience. And this review certainly tells us it enhances the psychosocial spiritual experience. So to conclude, it is a low-tech, low-cost option, although me and Ethel would argue that it's definitely a complex intervention when you look at all of these components together. It's valued by women, but we need to take responsibility as maternity professionals, all of us. We need to be much more proactive, ensure women have access to the birthing pool, that the birthing pool room isn't just used as a sick antenatal room or whatever it might be used for. And because we need to offer women with personalised care and an alternative to pain management. And so we need our services to ensure birthing pools are embedded into the planning and provision. And that means making it usable and accessible for people coming into the service. Thank you.